Welcome back to Feeling Good Feels Good. I am your host, Dr. Tripp. This is the podcast where we talk about total wellness and outright wellness. We look at wellness through four major categories: physical health, mental, emotional health, nutritional and chemical health, as well as lifestyle habit and environmental health. Today, we have a physical health episode. And one of the goals that I have with this podcast is to make complex things simple. Things that used to feel confusing, overwhelming, or like there was so much conflicting information. We're here to make these situations, circumstances, items simple and understandable. And sometimes we may even flip the script and make something simple like apples, beans, or oats entirely interesting, exciting, and complex. There's some things I just love learning about that I know so many people can benefit from. But at the end of the day, the goal is that you walk away with a simple understanding, interesting knowledge, and more ease and action steps on how to feel good. Today's episode is a pain in the neck. Literally, we're going to break down neck pain. We'll look at the numbers and data just so that we can understand who is affected by this, which groups of people are more likely to suffer from short-term and long-term neck pain. We'll give some basic understanding of what's going on in our neck in terms of anatomy and movement. We're going to make it very simple. There's going to be a little information about how our necks evolved to where they are today and where they might be going next. Most importantly, we'll talk about what causes neck pain and how to correct it based on understanding your own root cause of neck pain. I'll share some of the most common types of neck pain, treatment plans, and neck pain cases that I see in my office so that you can walk away at the end of this episode either knowing how to deal with your own neck pain, or if you're tired of giving your spouse or partner massages because their neck hurts all the time, there might be some helpful tools to stop the complaining and get you off the hook for those massages. So with all of that, let's dive in.
Welcome to Feeling Good Feels Good with Dr. Tripp.
Welcome to a state of feeling good. It's how we live and how you could. Just know it's how we're all meant to be. If things are off, listen to your body. It can tell us exactly what we need. Physical, emotional, nutritional, or mentally. No need to worry, it's reached accessibly. No matter how you felt or what you've heard, well-being's for everyone, it's what you deserve. Ease and joy are yours once it's understood. No need to fear, because feeling good feels good.
The information in this podcast is intended for educational and informational purposes only. It is not medical advice and should not be interpreted as a diagnosis, treatment, or prescription. Listening to this podcast does not establish a doctor-patient relationship. Always consult your own healthcare providers before making any changes to your health, medications, or treatment plans. The opinions shared here are based on clinical experience, research, and professional knowledge. They may not apply to any specific situations. By listening to this podcast, you acknowledge and agree to these terms.
Okay, with all of these episodes, they typically fall into one major category in terms of physical, mental, chemical, or environmental. And while neck pain is very much a physical health topic, as always, we're going to talk about this holistically and understand other factors from mental, nutritional, environmental will impact the way your neck feels. So how many people do you think experience neck pain each year? 1 out of 3. 1 out of 3 people are going to experience neck pain this year. That is 1/3 of the population of the world that deals with this issue. For some people, this can be as short as a couple days or a couple weeks, but for millions of people, this becomes chronic, frustrating, and impacts their quality of life. Neck pain is one of the top 5 causes of disability worldwide. It's one of the leading reasons that people take off time from work. It's estimated that the United States spends over $90 billion per year managing neck pain. That includes doctor visits, medication, imaging, chiropractic, acupuncture, physical therapy, and even lost time from work. And the wildest part about all that is most of that money is going towards calming symptoms and not actually fixing what caused it in the first place. But that's why we're here. Neck pain tends to peak in people aged 35 to 50. These are the prime earning years when people are working the most, working in different postures, and under work-related stress. Studies show that women tend to experience neck pain more than men. This is most likely due to structural, physiological, and hormonal differences between men and women. But regardless of who it is, one thing we're seeing far too often is that people just push through, they don't get to the original issue, and it just comes back in neck pain or something else. So how did we get here? To understand why neck pain became so common that it affects 1/3 of the population, it's actually important to look at the evolution of the human body and modern society. During early phases of our species, our ancestors were quadrupeds, meaning they walked on all fours, and the head was more supported by the shoulder girdle, and gravity was spread out along the spine, not straight down on top of it, meaning that when the head was forward and the shoulders supported the body, the force of gravity was dispersed through the different parts of the spine. Now today, when we walk, our spine is stacked on top of itself. So it's one big pull from the force of gravity from the top of the spine all the way down to the bottom. Then became an evolutionary shift, bipedalism, meaning that we walk on 2 feet. This completely changed everything for our neck. Now the head sits at the very top of the spinal column, basically a 12-pound structure balancing on a highly movable set of vertebrae. It's like taking a bowling ball and putting it on top of a flexible stick and expecting it to support you through running, jumping, and everything else. This evolution came with a trade-off. The human neck became more mobile, giving us better vision, awareness, and ability to communicate with other humans. You can now see what's going on around you, stand up straight, and talk to someone else while looking at them. But what got traded in for that was some of the structural stability built in, making our necks today more susceptible to dysfunction, especially with modern loads of pressure. Okay, let's fast forward some. The structure of our skeleton really hasn't changed much in the last 100,000 years, but our environment, our lifestyle, and modern technology, that is entirely different from how it was when we evolved. Instead of moving through different patterns of movement, walking, hunting, gathering, scanning the environment for dangers, we spend hours of our day sitting, staring straight forward, locked into our screens, creating what is now known as tech neck. It really is more than just bad posture. For every 1 inch your head moves forward past its normal posture, it adds 10 pounds of force on your cervical spine. So that forward head posture could be placing 30, 40, even 60 pounds of force on your neck. With the screens being right in front of us, it has greatly reduced the variety of movements in our day-to-day life. We're no longer looking side to side, looking over horizons. We're just staring in front of us. So instead of always blaming your neck or thinking you have a bad neck, your cervical spine and neck have supported you through a phase of time with obstacles unlike any other before. So maybe we should be thanking our neck and learning a little more about it. When I'm introducing the actual structure of the spine, I look at 3 main things. We have the bones, we have the discs that sit between the bones to absorb impact so that they don't fracture against each other, and then we have nerves coming out of our spinal cord, exiting the space in between each vertebrae. So those are the 3 main parts: the bone, the disc, and the nerve. But of course, we have ligaments that support the stability, muscles that coordinate the movement, and fascia, which is a connective tissue that looks like webbing that actually is entrenched throughout our entire body. So if you've never heard of fascia before, look up a picture of fascia. It's kind of crazy. People don't talk about this more often, but literally every part of our body, muscles, bones, nerves, organ, is entrenched in fascia. And we will have future episodes about fascia. So those are the main components of your neck. Obviously, on top of your neck, you have your head, your skull, as well as your jaw. Jaw dysfunction can be an overlooked part of neck pain. Below it, we have our shoulders, collarbones, rib cage, chest, and thoracic spine. Also, of course, possible components of dysfunction leading to neck pain. The nerves in the neck are the nerves that communicate with your arms, your shoulders, and your hands. So you'll often see numbness in the hands, sharp shooting pain down the arm, or shoulder dysfunction correlated with neck pain. Our neck is also extremely important for something that you may not think of: our balance. So much of the information that helps us keep our balance comes from nerve receptors in our joints. And the nerve receptors in our spine, particularly the top of our spine, are the main ones that dictate our balance, our spatial awareness, and coordination. Vision and breathing are also systems that your neck is tied into. So when someone is suffering from neck pain, sometimes you might hear complaints of vertigo, pain in the eyes, visual disturbances, head pain, jaw pain, and overall just feeling foggy and off. So when someone says, I have a stiff neck or I have neck pain, it's not a one-size-fits-all approach. But the paths to get better all become clear when we understand where the signs are coming from in the first place. So what are some of the reasons that our neck starts to hurt in the first place? Well, you can have a muscle strain. You can have a ligament sprain. You may have compression correlated with disc injury. You can have muscle tension and spasm, or even chronic inflammation. What do these look like? The first one I generally like to rule out is compression and disc injury. One of the main cues I look for to see if somebody is having compression in their spine is, do they have pain with looking up at the ceiling? When we look up at the ceiling, it compresses our spine even more. And if it increases pain, I'm starting to think about compression. It is by no means a 100% indicator, but it is something that I'm absolutely thinking about. If, while looking up at the ceiling, that person starts to have shooting pain down their back, down their arm, or tingling in their hands, then I'm thinking about this even more. This person may also have muscle guarding, meaning that after they experience sharp shooting pain, it feels like their neck locks up. This mechanism is the body trying to protect one of the most important parts, your nerves and your nervous system. It literally stops you from moving so that you can't irritate your nerves more. And that's a typical pattern for somebody who is experiencing compression in their neck. Sharp shooting pain, pain made worse by looking up, pain that's referring down into their arms, and persistent muscle guarding, aka their neck locks up after a flare-up with pain. Now, for these people, there is definitely a root cause that we want to get to, but initially, we just need to decrease the compression. Things like extra sleep, extra hydration, posture training, and decompression therapies like traction, spinal decompression, or even a neck hammock. I do like the neck hammock for many of my patients who I can trust with this tool on their own at home. If this person has compression on their spinal discs, likely there is some root cause tied to their posture. They've been in a car accident or a traumatic event that has caused their discs to rupture. And a huge indicator for somebody to be more suspect for disc injury is lack of sleep and lack of water. If you are not sleeping well and not hydrating and you are feeling these symptoms, then it is even more likely that compression may be a cause of the neck pain. Our discs literally refill with fluid while we're sleeping. And as we go throughout the day, they lose their hydration and actually become smaller. This is why people are actually a quarter to a half inch taller in the morning than they are at night. If you sleep well and hydrate well, your discs plump up while you're sleeping, and throughout the day, they absorb impact and become dehydrated. So you lose overall height on your body. So if you're not sleeping and you're not hydrating, you are leaving your discs suspect for injury. Add in poor posture, work stress, muscle spasm, and you're literally hanging your neck out to dry. This is generally one of the most severe types of pain. Some people do experience neck fractures. These are, again, generally from traumatic injury. It's very rare that a neck will just fracture on its own, although there are versions of arthritis bony changes that can be classified as a fracture. Most neck fractures only occur from very traumatic incidents, and you would know where it came from. Inflammation and muscle spasm is the most common reason that I see people with neck pain. They're having pain from the inflammation and their muscles are tight, triggering signals of pain. One way that we can look for inflammation is, does this get worse throughout the day and then become alleviated by rest? Basically, I sleep and when I wake up, I feel better and it gets worse throughout the day. And then I sleep and it feels better and then it gets worse throughout the day. That is a signal of inflammation. And with muscle spasm, muscle tension, you will just feel tightness, discomfort, and especially tightness with certain head movements. So moving your head side to side, leaning to one side, looking down, even looking up at the ceiling, like we talked about with compression, can still be a cue of inflammation and muscle tension. So just that feeling of achiness, stiffness, and if it gets worse with movement, especially movement throughout the course of the day, likely that's coming from your muscles and from overall inflammation. So for this person, we absolutely want to understand, why are their muscles so tight? One of the main reasons that I see this is actually weakness in the neck. People don't think about the neck the same way they think about their shoulder, their low back, or their knee. But it is bones that are held together and coordinated by muscles. So the same way your back or your knee can get very weak and cause pain, the same thing can happen in the neck. Compensatory movement patterns can start to build. Some vertebrae lock up while others take over more of the responsibility and move past their comfortable range of motion. So over time, an imbalance builds. For these people, we do need to strengthen the neck. We want to decrease inflammation, healthy food, gut health, supplements like fish oil and magnesium, proper rest and hydration can all decrease inflammation. Chiropractic adjustments have been shown to dramatically decrease inflammation. They can break the cycle of inflammation, but if corrective rehab and lifestyle changes are not introduced, that relief can just be fleeting. That's why you see people who go to the chiropractor and some have long-term success, but some will complain that it just comes back. Chiropractic adjustments are proven to be very effective at decreasing pain and inflammation. And breaking that cycle of pain and inflammation is very important. But if we don't address the lifestyle factors that are causing it, then these symptoms may come back. It may be days, weeks, months, or sometimes even years. Neck pain can also cause headaches. Interestingly enough, our jaw and the top of our neck share a part of our brain in terms of how they communicate to and from the brain. So sometimes your jaw can hurt because your neck is off, or your neck can hurt because your jaw is off. Clicking, tightness in the jaw, spasm, pain with eating, talking, or yawning can all be indicators that the jaw may actually be a source of your neck pain. And just like the neck, the jaw is also a joint. So yes, we can do muscle therapy and rehab to help correct this issue. Something that became popularized in the beauty world is actually something that I like for physical health. Have you heard of gua sha? Have you seen the little green stones that people use for facials? You can actually break down tension in the muscles, adhesions in the fascia, and tightness in the joint by using gua sha technique on your face and jaw. The last thing I want to bring attention to is dysfunction below the neck. Typically, weakness in the shoulders or tightness in the middle back. If our shoulders are weak, our body will start to compensate with the muscles of the spine and the neck. You might have neck pain with working out, lifting weights, reaching overhead. If you start to have neck pain when you use your arms repetitively, things like barbers, tattoo artists, or even contractors, this can be a sign that the neck pain is coming because you actually have weakness in your shoulders. Your shoulder muscles can't make it through your day, but you still got to get the job done, and your body will do that for you. So it starts to use the neck muscles to do the job of the shoulder, creating tension, pain, and overall fatigue and discomfort. And the final most common cause I see of neck pain is actually restriction, tightness, and lack of range of motion in the middle back and the rib cage. Our middle back is supposed to rotate, flex, and extend. Because we are so sedentary and we lean forward with our shoulders so much, the middle back can become incredibly tight. And just like the neck takes over for a weak shoulder, it can take over for a stiff middle back. For example, if you have to look side to side or put your head in a certain position and your middle back is tight, your body will get that done for you, moving your neck more than it was meant to. And you can have repetitive strain over and over. So for this person, if your middle back is tight, you have neck pain. I stretch my neck all the time. My neck is loose. My neck cracks. I feel like I'm stretching my neck so much, but I still have pain. There may be instability in your neck and restriction in your middle back. Things like foam rolling, yoga, and general range of motion exercises for your middle back can actually greatly help your neck. So those are the most common reasons that I see neck pain and the pathways to feel better. Neck pain can also be highly correlated with stress, chronic stress, anxiety, or trauma. Somatic practitioners look at neck pain through repressed communication. Basically, they think that if somebody is not speaking up for themselves, that's where their neck pain comes from. Or even just suppressing emotion and not processing grief or even anger. While I'm not a somatic practitioner, one thing that I found interesting about this was the correlation with anxiety. When we are feeling anxious, our breath changes, and we use the top of our rib cage and collarbone to breathe quickly with shallow breath. The muscles that do that movement are the muscles in the front of the neck. So if somebody is chronically having anxious breath, the muscles in the front of the neck can get strained. So if you feel stressed out, incredibly anxious, and like there is tension around your collarbone and the front of the neck, learning how to belly breathe and breathe with your diaphragm and breathe through the bottom of your lungs could be a very useful technique. If you have neck pain, just know that I see people all the time who think they will never live without neck pain. And when we uncover what's actually causing it, it becomes very simple to correct. So I hope you all have a better understanding of the neck itself, why it gets hurt, and where you can start to look to help yourself feel better. I can't wait to see you all next time on the next episode of Feeling Good Feels Good.